Thank you for having us. I am David Mason. I'm the Director of Public Health for the town of Sandwich. And joining us today also is Chief Burke of the Sandwich Fire Department. And we're here to talk to you today about the coronavirus, the concerns you may have, the impact of it, and how the town of Sandwich is dealing with it. So I'd first like to do is make you aware that Chief Burke had initiated our coronavirus team. And we have town officials who sit on that, and we've been meeting regularly. And who do we have on the committee, JJ?
So the town manager, the assistant town manager, school superintendent, public health agent, public health nurse, police chief, and fire chief.
Okay, so we have Chief Burke, myself, Joanne Burke, Joanne Gake, my apologies, Bud Dunham, Heather Harper, and Chief Wack on that team. And and we have been meeting regularly and keeping track of what is going on in this state and in the community. And just we want to give you a little history as far as what our actions are, because I'm sure you've seen many things as far as school closures, closings of certain group meetings, and you've heard the word social distancing. And that's what is being implemented right now, is social distancing. Just on a quick thing, the chart that's in front of you here is from 1918 with the Spanish flu. Now, not a lot of you remember that or were around, but what occurred in two different communities in 1918 with the Spanish flu, the difference between Philadelphia and St. Louis. And it was Philadelphia that decided they were having a parade to send people off in World War I, and Philadelphia decided to have the parade, and St. Louis decided to cancel. And you can see here the spike is where Philadelphia, the number of deaths in the community, because they had the parade. They had people in close contact with each other. Whereas St. Louis canceled the parade and minimized their impact to their community because of social distancing. So what's being practiced today to control this, what we refer to as flattening the curve. If we do not practice, here is a line which you may be able to see, but is the impact on our healthcare system. If we do not practice social distancing, the impact is going to overwhelm our healthcare system. If we practice social distancing, we will lower the level of impact on our healthcare system. So basically, social distancing is to minimize the spread of the coronavirus. And that's what we're asking for, and we're going to talk to you today about. So a number of different ways in which we can minimize the social distancing is, as we've talked about, we've closed the schools for a period of 2 weeks. We've postponed town meeting, and there's many other steps that can be taken also. As far as what people can do for themselves. Because what we're trying to do is protect also our infrastructure and the people that support that infrastructure, specifically our fire department and police department. Because Chief Burke can speak to, the process in which when he gets a call, what impact it has on the people the calls he gets. So when you get a call, Chief Burke, and they go out to a house for someone that's ill, what is the process now?
So it's a little bit different. When you call 911, the dispatcher is going to ask you a series of questions surrounding flu-like symptoms. If we get positive affirmation that some of those symptoms are in play, instead of having 3 members come to your door, there'll be an initial paramedic that'll come and do the initial screening. If you fit the criteria that the CDC has put out, you'll see some additional equipment that the firefighters will have on, including gowns, face masks, and gloves. We usually use universal precautions on everybody, but the addition of the mask and the gown will be for people that exhibit those types of symptoms.
Okay, so, and one of the important steps is that we're being advised by the Mass Department of Public Health too, is that if you're feeling those symptoms that Chief Burke described, you should reach out to your primary care physician. by making a phone call first. What we're trying to eliminate at this point, and with you providing as much information up front, is we're trying to protect the fire department's personnel. That is critical at this time, because they're going to be needed by everyone, so we're trying to minimize exposure. At the same time, we don't want you just hopping in the car, driving down to the emergency room, and just presenting yourself where we could contaminate or create an issue there. It's critical to make that first call to your primary care physician first. I mean, that will help protect a lot of people if they make that step.
I agree, and I think, and the other calls don't stop. So, you know, as a fire department, we're still going to be responding to calls for service, fires, car accidents. So it's really important that if you have to call 911, that you do answer the questions that the dispatchers provide to give us a little bit of a heads up as to how we're going to respond to that.
It's also important to know that in order to, as testing is expanded, that in order to get tested, you need a doctor's order to get tested.
Correct.
So really, you know, as far as whatever action you take, you know, that has to be the first critical step in order to get tested. They will not just test based on appearance. The doctor has to verify the criteria that exists relative to symptoms before you can go forward. So that's important to know, to think that if you're just going to step out and go somewhere and get tested, it's not going to happen until you have that communication with your doctor.
Correct.
Okay. The just so types of things that you can do, and Chief Burke and I have been talking about this, and the group is basically, I'm going to refer to it as personal responsibility at this point in time. As far as you have we need a commitment to our neighbors, to our community, that each of us are taking responsibility to minimize the impact. I mean, I'll go back to, times I had an elderly person talking to me about the time, when there was self-sacrifice, for World War I, World War II, in which each individual was asked to make a sacrifice, when there was gas rationing and all that type of thing. The time now is, the sacrifice is social distancing. You need to keep yourself away from people. But that doesn't mean you're locked in the house, does it?
No.
I mean, it's a beautiful day out. As far as it's today's Sunday when we're doing this. It was a beautiful day yesterday. You can get out and walk. You can get out and bike. There's plenty of yard work you can do. I mean, all those things that, you'd always want to get together with friends, go out to dinner, and get together with people. You always put off those little things that you wanted, projects and chores you needed to get done. Now's the time to get those things done, because that places a level of control, and that really helps knock down that curve that I showed you to minimize the impact of spreading this virus. Just a thought also as far as the minimizing. I know I've seen concerns. We're very cognizant of the concerns of local businesses, and many local businesses, your restaurants and whatnot, are recognizing how to adapt to this. They're offering call ahead, and they'll bring it out to you in the car. I've heard others say, if you have this thought of going out to eat, because you want to support your local businesses, I've heard people say, instead of going out to eat, call up and order a gift card, so that, when we're able to get out there, that you're able to go then, and you're supporting the business still then. And that's part of the sacrifice, and the sacrifice is helping each other in our community also. As far as reaching out for additional information, do you want to speak to, Chief, where we find certain information, that people can find certain information that we've been putting out?
Yep, so you have the general sources, the CDC, and we look more closely at the Massachusetts Department of Public Health website, so Mass DPH. They've also established Massachusetts a 211 hotline number where you can call and get answers to any coronavirus-related questions. When you dial 211, you're also, after that, going to hit 26, and that'll bring you directly to the coronavirus question and answer. So that's important. If you have any questions, thoughts, concerns, you can reach out to 211 and get those answered by somebody from the Mass Department of Public Health.
Perfect. And in speaking of that, with all the updates we've given you and that the COVID team is in place, we're monitoring the situation. Sandwich had the first case on Cape Cod yesterday. So we were fully aware of that. The COVID team was brought together yesterday for a number of hours yesterday, working to understand the situation and to control the situation. Through the public health nurse, we identified contacts of the individuals, and all those contacts have been appropriately identified and contacted. So if you haven't been contacted, you're not a contact. So, but at the same time, we have it in the community, and we do have a belief, even though we have a tested positive case, we do believe it exists out there. And it is moving on, much like the common cold will. You know, sometimes people get a cold and they're like, where'd I get this from? It's contact surfaces, contact with people. So you have to be aware that it's out there. Do not take this lackadaisical attitude that it doesn't exist or it won't happen to you. Precautionary measures are the best action at this time. So just as we've spoken with social distancing, many of the information that Chief Burke just gave you will provide you guidance on how to handle it. Hand washing, as you've all heard, is the simplest thing. Even before we sat down here, Chief Burke and I sanitized up our hands. So those are the precautionary measures that are necessary to take. So at this time, we're monitoring the situation. We're fully aware of what's going on. We're taking those measures to put control measures in place, but we need your assistance. In order to control that, we need you to be responsible, take the precautionary measures, and practice social distancing. And we'll be providing more information in the near future. Thank you very much.
Thank you.